This is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit today about the reality show housewives' lips, or what often people call duck lips or fish lips. And I really find that people are frightened when they come to me because they've seen these on television lips that look totally unnatural. In fact, they all look kind of the same and unnatural at the same time. And without, identifying any particular shows or names, I think all of us know what this means. We've probably all seen it in public. And the truth is that when it's done correctly, lip enhancement or augmentation with injectable fillers can be totally natural, and people don't even know you've had it done. It really should be taking the natural shape and boundaries of the lip and enhancing them. We ultimately want a nice diamond-shaped lip. And when I say diamond, I mean the overall shape of a lip. From the top part of the red lip down to the lower lip should be a diamond, not a rectangle, which happens as we age. I think those are important concepts to understand, and by really looking for the best outcomes and not trying to just jam as much volume into the lips as we can get in there, we keep a natural look that really makes the lips look beautiful, much more enhanced, beautiful with lipstick and lip liner and the sort of subtle things that women do such a great job of. And it's not really just for women. We have a number of men who have lip volume issues. They thin the lip involutes, and really just creating a little better lip border definition, rolling the lip outward, can give a natural look. And that's really just about the artistry and the individual judgment of the surgeon or physician that's doing the treatments. Lip augmentation is a really good procedure for many patients, and it's one that most patients feel really, really good about. It's something that can be done probably not more often than once a year, so it's not a very costly procedure if you're only doing that as a touch-up. And for most patients, the recovery is pretty simple. I do see some patients that get significant swelling. We use antihistamines if I see swelling, or even steroids, a little bit of prednisone after the procedure if we have more than expected swelling. Typically for my patients, it's swollen just a little bit overnight, not very much, subtle. Actually, some people like the swelling. We can always add more filler if patients want some more augmentation, but it's starting slowly, getting a nice result, and making sure people are happy with it, and most importantly, have a natural look to their lips that we're seeking. I think those are really key features in general. In the recovery afterward, there's really not many instructions. I tell people their lips are a little fuller. They may need to use a little bit of chapstick or some Aquaphor, a moisturizer for the lips. Actually, lipstick helps also to retain the moisture. You'll lose moisture when you have fuller lips. But kissing and things like that, as long as it's not done too aggressively, are totally fine. People can eat and drink and do their normal activities after lip enhancement using fillers. If you have any questions about lip enhancement, the procedure itself, which I think we've got documented on video, you can see the treatment and how it's done, performed, and even lots of before and after pictures. Please don't hesitate to write us, or go to maasclinic.com, or write the questions to drmaas.com. As always, I'm very happy to help you keep looking your best. This is Dr. Corey Maas.